issue is, not the issue, but they won the race of first. So everybody knows ChatGPT, but nobody knows Gemini. And it's just as powerful, if not more, in certain things. This is the model of Google in medicine. What do you guys think about it? How do you see yourself using it? What do you think, Dr. Nanavati?
I would use it, but it's there's some questions. I mean, how accurate is it?
Good question. When someone tells you AI, there are a few things you need to ask, and today I'm hoping that I could give you what are those questions. Because what I teach you today, I need you to take it to every single AI, including if your hospital tells you there's an AI that we're deploying in the EMR X. Those are the questions you need to ask yourself. And it's not just about accuracy. It's also, where was it trained? If you have somebody who is a medical student or a resident or an intern, the first thing you think is, hey, go give IV antibiotics to that patient. You don't just trust that it's going to do it. You follow up on it. So your AIs that you're going to use in medicine are like a medical student that never sleeps. It has a vast amount of knowledge, but needs guidance. And when you give it guidance, you need to verify after that it is accurate. I would be remiss if I was not invited by a cardiologist and not do something cardiology related. So this is Echo Prime. It's one of the AIs, and this is as the images and the snippets of video are being taken, the AI is given the interpretation immediately. Now there will always be a preliminary and a cardiologist finalizing the report. But I think that this is impressive. It's no longer just what's the prelim EF, and then you wait until the report comes in. So much like everything else, we will have to look at the model, and I'll teach you the phrase human in the loop. Today is about giving you also keywords so that you can assess all the AIs. So why should you care? What is your why? Why are you here today? It can't be just about intrigue. You're here today because it has infiltrated all of our life. It's here in our patient care. It's not, AI is not tomorrow. It's not the future. It's yesterday. It's already been here. It's around us. You've been using it without knowing that you're using it. So the first thing is, it's already in the hospital, in your EMR, all of the pop-ups that you have of DET prophylaxis, all the interactions for pharmacy, all of those, there is AI already being deployed. And a lot of the EMRs have already put in a co-pilot, which is an assistant with our dictations or with our patient notes. Clinical literacy is your protector. This is what's going to be by your side as you are practicing with AI. And please, for the love of everything that is good to you, AI is not here to replace you. Please don't go ahead, jump on that bandwagon. Just don't. It's clickbait. We all know what life we live now. People that want to have some sort of attention, that's what they want you, because that provokes an emotion. It's not rational. You cannot expect AI to be this is not intelligence. The word intelligence was used as a marketing tool. It's not real. The actual algorithm thinks in a certain way. It's not a thinking, it's not an intelligence. In fact, if you have Gemini or ChatGPT and you ask it in a language that is of the languages that are not popular, like Tamil, it will answer you even though it is not trained in Tamil. Why? Because it has an algorithm that detects probabilities. Does that mean that it can think in Tamil? It can't, but it does give you. And now we're rethinking in neuroscience if a lot of what we used to label intelligence, in fact, is a language model of our brain. Where are we in the AI wave? In the 80s and 90s, it was limited capabilities. We had more like machine learning and so on. We started to have neural networks. You'll learn this word. you're starting to have more transformers that amplify that reaction, and suddenly we're starting to have what we call generative AI. It's expensive to train these models. And now we are in the generative AI 2022 and above. It builds on the previous ones. So what is generative AI? When you hear AI, when someone tells you imaging, you don't just take the word imaging and not question it. What kind of imaging? Is it an X-ray? Is it a CAT scan? Is it an MRI? When you talk about AI, what kind of AI? At first, AI is the entire thing, which is the theory that builds machines that think like humans, that use the reasoning, that use the steps that we take in order to resolve a problem. Machine learning is beneath that, where you train computers to learn from previous data to replicate it into the next task. Then there is deep learning. Deep learning uses transformers and neural networks, and it amplifies the previous one. It's no longer one task to be replicated. It now uses that task to extrapolate to others, and that's what deep learning is. Within that, there is generative AI, and generative AI means that it generates new text, and because we can assign numbers to pixels, those can be predicted as well, so you can predict the next pixel, therefore create images, create audio. That's what generative AI is. When someone comes in and says to you, I have this new AI algorithm that can help you predict sepsis in the ICU, you ask, what AI are we talking about? Is it deep learning? Is it machine learning? What AI are we talking about?